You will be wondering why I'm asking so, because time is extremely important. And I believe that in today's life, all of us who are working as a physician or a diabetologist or endocrinologist, sitting to our chamber, working every day in and out for academics and routine work of clinical examination and everything, time would be one of the most important thing for all of us. Now, to put this context into the practice, the debate which is selected is that which matters more for diabetes control, that is exercise intensity or duration. I'm going to speak in favor of intensity, and I'm sure that after these 7 minutes, I will be able to convince you with the evidences and true mechanisms which work, which also has been endorsed by AD and RSSD and across the world for major of these societies. So I will not go into the brief of how exercise works. There could be low exercise intensity, there could be moderate, or there could be high intensity training. So I can use the word HIIT, that is high intensity interval training. So simple walking could be a mild exercise, brisk walking could be moderate exercise, and there could be a intermittent maximum effort intervals where brief recovery periods are allowed, that is high intensity exercise. So I'm going to speak in favor of the third one. Now we cannot talk this session without measuring how exactly we measure the mild, moderate or severe intensity. So there are various methods which have been adopted by various guidelines, and trials also have been including this. They are maximum heart rate, VO2 max, metabolic equivalence and talk test. I'm not going into the detail, you can have a screenshot, but yes, it has to be quantified. We cannot compare one with other without any evidences or without any standardized measuring units. So simply you can calculate your maximum heart rate which is allowed is 220 minus your age. Now, if you want to differentiate between the low intensity, moderate intensity and high intensity exercise, this is how you can table them. And you can choose any of that. If you, even if you don't have a smartwatch, if you are staying in the remote village area where people don't have a smartwatch, you can simply ask them that, are you able to talk while you are going for walk? Then you are doing low intensity. If you have some difficulty in talking, you are doing moderate intensity exercise. And you, if you are running very hard and fast, you are doing sprints or everything, then you won't be able to talk. If somebody asks you, hey, hi, how are you? You won't be able to say hi. You will have to rest for a minute. That is high intensity exercise. We are going to evaluate the benefit of that versus moderate brisk walking. So what is high intensity training exercise is that there are intense activity bursts which are alternated with the recovery periods. That's what high intensity exercise means. It's not steady state. It go up, you cool down, you burn up, you cool down. That's what high intensity interval training exercise is. So there are various types of exercises. They are famous across the world, including India, Europe, Asia, any corner of the world, any gym, any center where exercise is being encouraged, they are there. It could be cardio based, it could be strength based, it could be circuit based. So it could be alternate with the cardio and circuit in a single session. Even in Japanese studies, and in Japan it is very famous across the world also, that is Tabata, where you have 4 minutes of exercise only, where there would be a 20 seconds of exercise, which is at high intensity, 10 seconds of rest, that is 30 seconds. You do it for a minute, that is 2, and you do it for 4 minutes, that is 8 sprints of exercise, right? So that will just 4 minutes and you can burn a lot of calories. Now, let's understand the science of exercise. I believe this is the most important part of the talk, which will be able to convince you. What happens when we do exercise? It's all about the energy metabolism at cellular level. We take oxygen to survive. Why we take oxygen is at cellular level. We require oxygen to enter into the Krebs cycle at the mitochondria. But there is another mechanism which is gifted by God to all the humanity. That is anaerobic mechanism, which occurs at the cytoplasm, where the glycolysis occurs. So in the time of crisis, when you are unable to breathe and you still have to take an output from your muscles, you have to have a glycolysis. For that only we have a stored glycogen in liver, we have stored glycogen at muscles also. Now try to understand that even if glycolysis and Krebs cycles all get together, when we do exercise, the Krebs cycle first comes into the way where we are breathing. Aerobic exercise is when you are taking a deep breath. You are going for a brisk walk. That's what will happen, right? So you are breathing, right? You are breathing very fast, but not extremely fast. So at that time, at the cellular level, your oxygen consumption is increased, but Krebs cycle is working. But when you go for the high intensity interval exercise, at that time, you are running so fast, you are lifting the weight so hard for few seconds, the oxygen consumption will not be sufficient. What body will do? As God has gifted, there will be a glycolysis. So there will be a glycolysis at the cellular level, particularly at the muscle fibers. And that glycolysis by anaerobic metabolism, even though it generates less ATP, but it is very faster. It will immediately give you energy spot. But the benefit is that at the liver and at the muscle, the Cori cycle is very famous and well known to all of us in the maybe second or first MBBS classes, where whatever pyruvate has been generated out of the Krebs cycle and anaerobic metabolism, that will get converted to lactate, but lactate will go back to the liver, where liver will make it back to the glucose. It will come back. But the benefit of this is at the end of this high interval training exercise, whatever amount of glycogen has been lysed by the muscle, that glycogen store will deplete. It will provide us energy. So it will spare the oxygen and it will cut down the glycogen within the muscle fiber. So more muscle fibers will get recruited and more glycogen will get stored off. And whatever glucose comes, it might go back to Krebs cycle. So in nutshell, if you want to remember, the aerobic exercise, they will consume oxygen at mitochondria, but anaerobic combined with aerobic will have both the benefits of glycolysis also. And glycolysis is extremely benefit for every diabetic patient, because when glycogen level goes down, definitely there will be a insulin sensitivity which will be enhanced. That's the crux of the story. So there are a lot of high intensity exercise benefits, improved cardiovascular fitness, insulin sensitivity is increased at very less interval of time, 4 minutes. There are trials which have been performed, just 10 seconds of peak can have shown benefits. Increased fat burning is also one of the benefit. And please remember, there is something which is called as excess post exercise oxygen consumption, that is EPOC. So what I have explained is the same thing, that even if you stop exercising and you are taking the rest, when body has gone for anaerobic metabolism, gradually again it will come back to aerobic metabolism. So even you are resting, body is burning calories. And studies have shown that even few seconds of high intensity exercise can burn calories up to 24 to 48 hours. So it's like you invest today and maybe a month later your amount is doubled in stock market. That's how this works, right? So it's a wonderful science and benefit has to be there. There are also trials which have shown that there is muscle strength which is improved, mental health is improved, enhanced metabolic rate is improved, and improved athletic performance are also observed. Versus that, if somebody is not doing high intensity exercise, but only duration is kept in mind, and they are doing moderate intensity exercise, there are cardiovascular benefits, but they are limited. There is a plateau in the metabolic health. There are lower hormonal benefits, and risk of overuse injuries are also there, because if you run for a prolonged hour, if you walk for very prolonged hours, maybe 1 or 2 hours a day, in greed of getting more benefit, you might end up with osteoarthritis or some injuries. Anaerobic system is absolutely neglected in this. Psychological monotony is there, because many times you keep on walking at the same place and you do same activity, there won't be fun inside, and person starts losing interest in that exercise. There is limited impact on the strength, and it is extremely time consuming, which is very hazardous for at least people who are living in the urban area. Now, what about the high intensity training exercise recommendation by the guidelines? Now, ADS clearly says that even if you do 150-minute per week exercise, they have already said that you have to do at least two times a week, high intensity exercise, resistance exercise, to have a top of benefit, right? And strength training is also recommended by ADA. They have also said that vigorous intensity exercise is also recommended as a part of well-rounded fitness plan for a better glycemic control. But yes, you have to make sure that this is individualized. Even in high intensity exercise, there are low, intermediate, and high volume of exercise, as if you just exercise for a peak for 10 seconds to start with. Then you gradually improve by 20 seconds and 30 seconds, looking obviously to the patient's age, cardiovascular status, CKD status, osteoarthritis and age and everything together. But it has to be tailor-made. But every effort has to be made, that patient has to be explained about the benefit of these, that moderate intensity exercise alone is not important. You have to have intermittent high intensity exercise along with these. So safety keeping in mind, RSSD also has endorsed the same guidelines based on the findings of these. Now, in just last 2 minutes, I have time that I will quote some of the studies which have shown benefits. One of the most famous studies, HIIT, the Diabetes High Intensity Interval Training Exercise Study, which was published in 2015 in Diabetes Care Journal, which have shown that the glycemic control and insulin sensitivity, is it better in control group versus person who are doing the high intensity exercise? So if you see the top part, the pre and post exercise, definitely post exercise of high intensity interval versus control who are doing moderate exercise have better control. And the second part, the bottom part, is the CGM data, which also shows that throughout 24 hours, it is not at the peak of exercise. Throughout 24 hours, the benefit is prevailed. So high intermittent training exercise has definitely good control. And if you see the basic data, 24-hour blood glucose, there is 20% reduction versus 5% reduction of the control group. VO2 max 12% increase versus only 4% increase. HbA1c 0.3% reduction and no reduction, no significant reduction of moderate intensity exercise. Yes, it improves cardiovascular health, but as far as the HbA1c reduction is concerned, the benefit is this seen only when you have a high intermittent training exercise. And insulin sensitivity is increased by 25% versus 8% of moderate intensity exercise. Not only for type 2 diabetes, even obese type 1 diabetes, there are paper publications available, which was published in 4 5 years back in Diabetes Care Journal, where they have seen that obese type 1 diabetes patients, they were randomized between the high intensity and low intensity group of exercise. They have shown significant reduction in HbA1c when high intensity exercise group was concerned. Not only that, pre-diabetic patients are also have been observed for these, and those who have been published in Diabetes Spectrum, they have shown that even low or moderate or high, any of the volume of high intensity exercise is translated into the benefit of HbA1c reduction to the pre-diabetic. So whether pre-diabetic, whether diabetic type 2 or whether type 1 diabetes with obesity, high intensity interval training exercise, even at a low volume, definitely has better outcome on glucose control. There are certain real-world evidences also which are published in Journal of Applied Physiology in 2017. There are improved muscle mass and strength in individuals as well as maintaining mobility and independence also. So this could be very useful for patients who are middle-aged or on the higher side. So to conclude my talk, intensity matters a lot as a clear-cut winner for glycemic benefit because it has shown improvement in the insulin sensitivity, reduction in the fasting postprandial sugars. 24-hour CGM data also are supporting that, as well as HbA1c reduction are observed. Cardiovascular health benefit are already there with it, and most important is that it saves time. So a lot of people, they don't have time. You can ask them that a little bit of sprint, squat, uh, climbing the stairs, where you are doing your routine exercise, consulting your doctor, that will help you out to improve your cardiovascular and sugar health. So I conclude my talk by saying that your body can stand almost anything. It's your mind that you have to convince. Thank you so much.